This is Abia COVID-19 update.
Abia COVID-19 update.
COVID-19 seems to be waxing strong, but I believe that we will win the war. Many things have changed since the last time we were here. Case loads dropped significantly between September and November 2020, leading to the government, of course, relaxing the lockdowns and the opening up of the economy. Well, they also briefly closed the isolation centers. However, due to the increased number of COVID-19 cases in Nigeria, the federal government ordered the reopening of isolation centers and the treatment centers in the country. That was on Thursday, the 10th of December 2020.
This is Abia COVID-19 update.
Abia COVID-19 update.
Well, that's speaking on behalf of Boss Mustafa, Secretary to the Government of the Federation, and the Chairman of the Presidential Task Force on COVID-19, Hadi Sirika, the Minister of Aviation. On that particular day of briefing, the PTF Chairman, Boss Mustafa, was on self-isolation. Well, Nigeria is well into the second wave. Imagine recording a whopping over 1,000 single cases in a day when we've stopped aggressive testing like we did during the first wave. And of course, globally, COVID-19 cases are also on second wave across the globe, with countries like the United States, the UK hitting new highs in terms of case loads and the recorded deaths. Well, considering the rise in cases in the country, Nigeria has also entered the second wave of the pandemic that has gripped much of the world already. This remains a major concern anyways, as more Nigerians return home for the holiday from countries with high COVID-19 cases with new variants, and also returning home from states, the Abians returning home from states with high case loads. Of course, COVID-19 vaccines made by Pfizer have recently been approved by the United Kingdom and the United States and now been administered to the citizens in that country. United States also approved the Moderna COVID-19 vaccines. These are some of the things we will get to know later on this morning on the program. Welcome. It's Abia State COVID-19 update. The Abia State Interministerial Committee on COVID-19, in response to the second wave of this coronavirus and the abuse of the preventive guidelines, decided to relaunch this program, Abia State COVID-19 Update. My name is Michael Oni. Well, on this program, it's a daily program. It runs Mondays through Fridays on several radio stations in the state, and the program highlights daily reports of the committee on the control of COVID-19, as well as the state governor's efforts in ensuring that the state is safe from the virus. With the simulcast emanating from Flow 94.9 FM, we're also live on BTA 88.1 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of Abia State, and of course Buzz 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of the state. We also have a new addition, Family Love 99.9 FM in Umuahia. Well, just before we look into the statistics today and the updates of coronavirus globally, in Abia State, the state government has directed a full relaunch of the preventive and the control measures in order to mitigate the effect of the pandemic on the people of the state. Of course, the chairman of the committee is Barrister Chris Eze, and he said this is following the recent surge in the number of the confirmed COVID-19 cases globally, and of course advised Abians and residents in the state to take personal responsibility for their protection and that of their loved ones by adhering to the COVID-19 protocols in the state. Well, this morning we have joining us live in the studio, Abia State COVID-19 studios, the Commissioner for Health in the state. Of course, he's leading the health workers, the frontline health workers, to contain the spread of this COVID-19. We have a new variant in Nigeria that is different from the one in UK and also different from the one in South Africa. Of course, we have a lot to battle with, especially as Nigeria is battling with the second wave of the COVID-19. Dr. Joe Osuji is joining me this morning in the studio. Good morning to you, Doctor, and welcome back to COVID-19 Update.
Good morning. Thank you.
You're welcome, Doctor. Let's talk about what the state government is doing to ensure that we curtail the spread of this second wave, and what is the situation on ground?
Well, thank you very much. Like you rightly said, that isolation centers were closed after the first period where the incidences, went down. But I wish to tell you that in Abia State, our isolation and treatment centers never got closed. It remained open, and we are handling cases, treating, discharging, and again collecting samples all over through the 17 local government areas. So we never stopped. We never relented. So this morning we're talking about the new wave of the coronavirus.
Yes.
Now, it's the same thing, though they're talking about new variant of the virus coming into the country. We are yet to get that because the testing formalities are still the same. We're still getting what we're supposed to get, SARS-CoV-2, and we are doing the best we can. Like in Abia, we have done this Abia Mask Challenge, which has been, a program that the state government and the Ministry of Health are doing through the telehealth initiative.
Okay. Interesting. Now, let's look at the testing centers now. As it stands now, do we have patients there? Are they receiving patients? And how many patients do we have as it stands now, as of today?
Yeah, we, since about 1 month, we've been admitting and discharging patients, some on self-isolation and treatment. We discharged 14 cases in the past 7 days. 14 of our patients got discharged. Presently, we have 1 patient now in isolation. Presently, now
okay,
we have,
presently one.
Yes, one.
Which brings to question: are people coming for tests? Are they testing?
Yes, we are just overwhelmed by the number of samples collected all over the state. All the local government areas, have sample collection centers in all the local government areas, and they are collecting samples every day. Every day. So the testing centers are actually doing their work, and they'll be working relentlessly.
Okay, let's talk about the sensitization now. We have some non-pharmaceutical protocols put in place just before we had that. I will call it a short break because we had reduction in case loads and, of course, the number of cases reported by NCDC. Now we have a second wave. Let's talk about the sensitization. As it stands now, I will say we have zero compliance on the streets of Abia State. So
I should say yes, because most of the protocols put in place, they've just relented in those protocols. Wearing a face mask, we don't see them again. Overcrowded situations, people go there without their face masks. No physical distancing again, and no washing of hands, and keeping all the healthy protocols that have been put in place. They're no longer there because people will now think that COVID-19 is gone and there's nothing like COVID-19 again. So that's why we're having this resurgence of the virus all over the country, not only in the state.
So what is the effect, and of course, on the masses?
Yeah, the effect is that the virus incidence will rise. And when that happens,
you smiled.
And when that happens,
okay.
Of course, we know the catastrophic effect of the virus, the pandemic, and what we're dealing with. You can lose your life when you report late.
Don't you think we should lock down? Of course, instill some of those restrictions that we had initially.
Well, I don't think locking down will solve our problems, because when you check the state of the economy all over the world and even in Nigeria and in the state, locking down will lock up people's ways of livelihood. But the only thing we'll talk about is the awareness that we have tried to keep in place should also continue. I keep telling people, you just have to wear your face masks everywhere you go to, especially unless you're in your house where you are with your family. Otherwise, if you're in a public transport, wear your face mask. If you're in a gathering, wear a face mask. Keep personal hygiene to be the utmost in your daily activities. And by that, I think we'll do the best we can. If you notice any sign of illness, just report to the appropriate places and you'll be taken care of.
Okay, I have a very important question. Nigeria Medical Association came out through the president of the association, Professor Innocent Uja, that was yesterday, and said over 20 doctors died within 1 week due to complications of coronavirus while treating patients that got infected with coronavirus. And it's unfortunate because they are the frontline health workers. They are the soldiers at the war front. I hope we do not have any doctor from Abia State. If yes, then what is the state government doing to ensure that our doctors and other frontline health workers are safe?
Well, that's a pathetic story, coming to save life and you lose your life. Well, that's one of the sacrifices a doctor, has to take. But in Abia State, none of the doctors who have in Abia State, has lost his or her life.
That's okay.
We take precautionary measures because we advise all the frontline doctors, even those that are not in the COVID treated centers.
Okay.
You guard yourself first. It's just like when you enter the airplane, they say for you to even protect your child, first of all protect yourself. You guard yourself before you enter into the isolation treatment place, and again treat your patients. Wear your face mask. Just put your PPEs correctly, and you go in there. When you finish, you come out. Nothing happens to you. Just personal hygiene must be utmost in everything we do. Doctors in the state, they are provided with everything that they need to work with, and that's why I think we've not had any casualties on the part of the doctor. Government, as it were, is trying everything within its reach to make sure that doctors are protected by giving them whatever they need to have in order to work well.
Okay, I'm going to run through the lines, the number of the Abia Telehealth Initiative now, in case you have a suspected case. And of course, what I mean by suspected case, Dr. Joe Osuji will definitely expatiate more on that later on this morning. The number is 0700 2242 362. 0700 2242 362 in case you have a suspected case of COVID-19 near you. And it is very important that we follow the protocols. Which protocols? Talking about the use of your face mask, especially when you're stepping outside. Very, very important. We have a new variant out there. Well, now, how can we categorize a case as a suspected case, doctor?
Simple. The presentation of the person or the patient to the doctor. You have fever, most times unrelenting. You have cough, which is dry. You have malaise, joint pains, and feeling of unwell. Most times you may not have any respiratory symptoms.
Interesting.
That is subtesting. Then if you are in an environment where COVID-19 cases are, or you have interaction, you have contacted somebody who had that virus before or who is still having the virus, you are a suspect. So you get yourself tested.
In case there is an Abian listening right now, and the Abian falls in this category of what you've listed, what should the person do?
First of all, report at the appropriate places. Either you go for if you're in the rural area, go to the local government areas where we'll have the sample collection centers. They pick up your samples. Then as they are moving your samples, you can dial the telehealth numbers, and you get instant attention.
Okay.
From the doctors who are always very there, to attend to patients. While your samples are being transported to the testing centers, we'll also keep in touch with you because we'll have your numbers. So once the results come out, well, we'll call you people.
If it is positive.
If it is positive, we'll call you. If it is negative, we'll also call you.
Okay.
That's your sample is negative, but it does not confer immunity to you.
There is a window period. There is a window period between you getting tested and when your result comes. What should the person do?
No, the most important thing, if your sample has been collected for testing, just keep away from wherever you are. If you are in a COVID environment, stay safe. Observe all the personal hygienes. You have to always wear a face mask until you are told you are positive or you are negative.
Very important. Always wear your face mask. And there should be a message to those, because we have a lot of places in town right now that are overcrowded due to the festivity. We had Christmas a few days ago. Now we're preparing for the new year, and we had protocols in place before the Christmas period, before relaxation of these protocols. And of course, we had restriction of movement in churches. We had the number of persons that can worship at a particular time. We had all these protocols. Are they still in place?
No, they've violated all those protocols. They're not still in place. You go to churches now, go to burials, to get over 1,000, 2,000 people crowded together, go to churches, they go to the market, everywhere. So clubs are opened, people go to bars, overcrowded, eating joints and all those things. So you find out that, and when you look into them, most of those people there don't wear face mask, don't observe personal distance. So
that should be a source of worry to the committee, the Interministerial Committee on COVID-19 in Abia State.
Yes, now that's actually what we're doing right now. We're trying to sensitize people and let them know actually what is happening now. And when you talk about this new wave that has just come in, awareness has to be created. That's actually what we're doing. The town hall meetings, the town criers. That's actually when you see the telehealth initiative talk about Abia Mass Challenge. That's actually what they're doing. People have been responding, and it doesn't go for free. There are some pamphlet things that they're giving to them. If you show up that you've complied with that for a very long time, put on many entries because of it, you get something out of it. So people are responding, and there are people that are taking care of their health.
Interesting. So it's an appeal to you as an Abian. If you're listening right now, or you traveled home and you're presently in Abia, you traveled from wherever you're coming from, it is very important you abide by these protocols. We have COVID-19 to battle with as it stands now. Use your face mask, sanitization, of course, sanitize your hands, of course, definitely after shaking. Do not shake. It's even important. Don't shake. There are different methods of greetings. Of course, it's very important we follow that. Anyways, as it stands now, as at 8 a.m. today, there are 81,154,259 coronavirus cases globally, and with over 1.7 million deaths recorded, while 57.3 persons have recovered. Don't get it twisted. Those numbers are people. And South Africa's President Cyril Ramaphosa called an emergency meeting of the country's National Coronavirus Council today amid a rise that has taken the country to 1 million confirmed cases. South Africa is the first country to cross the 1 million mark in Africa. European countries launched a massive vaccination drive. That was yesterday, with elderly people and medics lining up to take the first shots to see off the pandemic that has claimed more than 1.7 million lives worldwide. And of course, Saudi Arabia has extended a ban on people entering by air, sea, and land for another week amid fears about new coronavirus variants. And it is very important that we abide by these protocols. As it stands now, we don't even know if the vaccines can cater for the variants that we have. In fact, in Nigeria, the new variant of the coronavirus, when we say variant, the coronavirus is behaving in a way that is different from the usual that we know that scientists have studied. So we have a new variant in Nigeria that is different from the one found in South Africa and also the United Kingdom. And Dr. Anthony Fauci, the head of the US Coronavirus Task Force, said that he believes the COVID-19 variants detected in UK must be taken very seriously, but it is not likely to cause more serious illness and be resistant to vaccines. That's according to him anyways. But let's break it down and bring it back to Nigeria, as Nigeria officially confirmed entering the second wave of the virus. The country recorded 1,254 deaths as of Sunday, after 7 more people succumbed to the disease in the previous 24 hours. Of course, in the past 9 days, there have been 42 recorded deaths from the virus. And of course, in the update yesterday, 838 cases, new cases, were found in 16 states over the previous 24 hours. And the latest figure, the country's total infections is now 84,414. Don't forget, from the early December, there has been a spike in coronavirus cases in Nigeria. One of the reasons we relaunched this program for sensitization to remind you that coronavirus is still very much here. Do not throw caution to the wind. I will take 2 calls if possible. Let Dr. Joe Osuji respond to some of your questions about COVID-19 in Abia State. And of course, we call it a day to return tomorrow. The program runs every weekday, Mondays through Fridays, on several radio stations in the states. 0808-182-6949 or 0811-605-2949. Hello, good morning.
Yeah, good morning, Michael.
You're welcome.
Yeah, good morning to Dr. Suji.
Good morning.
Yeah, it's Alvin. I'm calling you from Benda.
All right, Alvin.
I must commend Abia State government. They have done their best to see that this disease, the level of infection is controlled. Now that the people have refused to, of all the things we have been shouting, the people have refused. What do we do in practical time? Because the responsibility of the individual to protect himself. I am attending a burial ceremony. I can confirm to you that we are not up to 5 putting on face masks in such a gathering. So since all the announcements, both in the marketplace, in the churches, what do we do in practical time to see that since people have refused on their own to obey these simple precautionary measures, what do we do? Have a nice day, Michael.
All right, thank you very much. Let's take this and the commissioner will respond. Hello, good morning to you.
Hello, good morning, Michael.
Yes, you're welcome.
Yeah, good morning to your guest investigators.
Yes, go on, please.
I still remember the last night. I'm coming from Mobile.
All right, love smile.
Yes. The second wave of COVID-19 was really interesting. I mean, if I look at it like the number people are giving out, like how immediate answer that people will take what they call the numbers. And sometimes I heard of when somebody was talking like you go to a police station that they will give you a specific day number, the day you come and they will isolate you. And sometimes this we can take yourself for COVID-19 so that you confirm whether you have COVID-19 or you don't have it. Sometimes when you go to that isolation center, everyone will be if they give you number to if because they have the COVID-19 before the day they put.
All right, love smile. Thank you very much. I would like the Honorable Commissioner to respond to those questions. He spoke. Alvan spoke about the compliance level in the state, and Love Smile spoke about the numbers, about the upsurging numbers.
Well, the compliance, like we said, has been very low, and we keep sensitizing, people, creating awareness here and there, and make sure people comply. And the government has set up a mobile court to deal with these cases. If you are not, putting your face mask and you are caught, the mobile court will deal with that, decisively. And when one or two, persons are, dealt with, either sentenced to a fine or jail term or whatever, I think people will not take steps to correct the ills they're doing.
All right. Thank you very much, Honorable Commissioner for Health in Abia State, Dr. Joe Osuji, and many thanks to the partnering radio stations, BC FM, Flow FM, Vision Africa Radio, Buzz FM, Real FM, and Family Love FM. The program returns tomorrow at 11 a.m. My name is Michael Oni.